Hello, welcome to another session. I'm sure my camera is really horrible today, but unfortunately, we're starting a little bit late today because we're experiencing some technical issues. But we are back with your favorite mental health discussion. We are back with the conversation that you truly love. And we are back to provide information, solution, and to educate more people about some of the issues that affect us as people. Today on the show with me, we have very qualified practitioners. We've got psychologists, and of course, we have Dr. Mercy Ngeusang, who is going to be sharing more tips and more in depth with regards to our topic for today, which is breaking the generational trauma. We need to break the cycle. I am sure most of you were in our last session where we were talking about generational cycle and how to break that. We kind of explore what this is in our African context. And our speakers last month were seasoned practitioners who are dealing with such cases every day. But sometimes conversations like this should not be one-sided. It is always important for us to look at an all-round, to look at how other people in a different dynamics, different environment are dealing with something similar. And that is why today with us, we've got Dr. Elaine TRAYLOR, we've got Dr. Mercy, and we also have Jae, who is not yet, Jae COLLINS, and of course, we're going to be speaking with Kalea ELLIOT. So while we start this conversation today, we are hoping that they're going to join us because we were all experiencing, technical issue. But I'll start by saying welcome to those who've joined us already. I would love you to share this link so that more people can join this conversation. It is going to be a very it is going to be conversation, in-depth conversation, but we want to encourage everybody out there to pop their questions, in the comment section. If you have any contribution to do, just like all the time, you can do that by just dropping your comments in the comment section. We are going to bring this on screen and we're going to answer if it's a question, and we are going to share if it is your recommendation or your point. So right now, without further ado, I am going to introduce Dr. Mercy. No, I think I'm not going to start with her today. I want to start with Dr. ELLIOT. I want to start with Dr. ELLIOT TRAYLOR because I want her to tell us who she is and why she is on this show today and where she is checking in from. So I'm going to pop her on the stage. Hello, Dr. TRAYLOR. How are you? Good morning. How are you?
I'm doing fabulous. It's a little rainy in Dallas, but it's a great day already.
Oh, that's good. It is great because you are here with us today, so it's great already. So what I want to ask you is, tell us a little bit about yourself. Who are you? It is always important for me to give you the floor to introduce yourself because there are all these hidden things that I can't tell, and I'd like you to spill the TTs.
All right. Well, my name is Elaine TRAYLOR. I'm a psychologist with a group called Team Health. And is the echo a little too much for you guys?
No, I'm just going to mute myself so I don't get it.
Okay. Oh, good. Excellent. Okay, so my name's Elaine TRAYLOR. I'm a psychologist with Team Health. I've been a psychologist, I can't believe I have to admit this in public, for 23 years. I have been the last 20 years working with geriatrics. So I work with elderly folks in skilled nursing, long-term care, assisted living, and I love it. I did all my pre and postdoc training in child and family psychology. And 20 years ago, I started working with geriatrics and I never looked back. I love it. So I have had a great deal of exposure to families and generational trauma. It's it's such an important topic now that the board of psychologists are requiring that psychologists do continuing education on what they call, trauma care, so trauma-informed care. And it's really important because it affects families everywhere. It's really, sadly, any generation, any age, any income level, any education, trauma can affect families. So I will talk a little bit today about my experience as a psychologist working with families and generational trauma.
Thank you so much. That's a spot on introduction. Thank you so much for being with us today, Dr. Troll. I can't wait to hear all what you've been able to consume in 30 years. I just want to know all about it today in one day, 1 hour actually. So let me
Right,
pop
right.
Dr. Mercy on the stage, and usually I'll introduce her and I'll read her bio and I'll say who she is, but I love the way you have introduced yourself, and I think I want to give that opportunity for Dr. Mercy to introduce herself as well, as eloquently as you have. Hello, Dr. Mercy, welcome on my stream. How are you?
Good
Good
morning, good
morning,
afternoon, good evening,
evening,
wherever you
wherever
are.
you are.
Have the blessing meeting you
Blessing
in
meeting you
person.
in person.
I've heard about
I've
you,
heard about you.
and nice to be
And
here with you today. Can you guys hear me?
we can
So,
hear you. We just muted ourselves because we didn't want the
oh, okay,
echo to interrupt you.
My name is Mercy Ngeusang. I am a psychiatric mental health nurse practitioner, a doctor in nursing practice, and it's all about me talking about mindfulness, your thoughts, how they can direct you. All these conversations in mental health just trigger something in me that awakes me wherever I am. I've been in mental health for so many years, but just tired of working up and down, going everywhere. So I founded All Mercy Psychiatry and Integrative Care, and I am the co-CEO of this practice. We have seen a lot of growth. And one of the dimensions of what we have been seeing as well is generational trauma, dealing with generational trauma. And Dr. Traylor, I am so happy that you mentioned trauma informed care. Before, there was nothing like that. All we knew was PTSD and how to handle it. The specialty of trauma informed care and embedding it into psychiatry and psychology today gives a lot of opportunity for people to seek help, not just seeking help, but become aware that something happened. So I am so thrilled. Let us kick it off. Let us talk about it. Thank you so much.
Thank you so much, Dr. Mercy. Let us talk about this. I love how you introduced yourself. You have this way of making me want to change my career. In the next few years, we might see Adeline, taking that direction, because I believe both of you are doing something that is truly fantastic, something that is so important, something that we neglect in our community, in the society today. And this is taking care of the mindset. So what you are doing, you're taking care of the mindset. And I read somewhere 2 days ago that the mindset is the most important thing in life, because the mindset determines how high you want to go and how low you want to go. So
They
if you
say change your
manage,
mind, change.
if you change your mind, you can, so if you manage to master that mindset, which you girls are doing so fabulously, then life will be better, life will be easier, and I bet you we're going to have a much more peaceful community. But let me ask you, Dr. Traylor, tell me, what is trauma? What is generational trauma for you? So if you tell me what trauma is, and then you can narrow it down to what generational trauma is, that will be awesome.
Okay. So I see trauma as anything that is, how do I describe it? I tell people sometimes, my clients, if you have something that's etched you, something that has marked you in a negative way. Okay. So obviously sometimes we have something wonderful that happens to us, the birth of a child and our raising our children, that has etched us in a positive way. Well, trauma can be something that etches you in a negative way. Now, it doesn't mean the rest of your life is going to be spent focused on that, what has etched us. However, it's something that we've experienced that we can't take out of our experience. I give the analogy of ink in the water. If you put a drop of ink in the water, you can't get ink out of it. Now, you can dilute it and you can try to adjust to it. Unlike if you put a pebble in water, you can take the pebble out. If you put ink in water, you can't get it out. So trauma is anything physical, emotional, sexual, spiritual that has made a mark on you, that it will be a factor in your development.
Thank you so much. And when we talk about generational trauma, how would you describe that? How would you put a generation in front of the trauma?
Right. So we have this etch that's happened. And then it affects the way we parent. It affects the way we treat our parents, the way we communicate. So we know in relationships, relationships are seen in factors of trust and respect and communication. Those are these three factors that I talk about in relationships. So when you've experienced a trauma, and maybe it was even at the hands of your parents or while you were living with your parents, it affects the way you communicate and trust and respect your parents. And then when you go out into the world, you have that message that's been developed in you. And then you meet someone and you have children. And then you sort of replay that message or have that trust and respect and communication with your children, whether you're aware of it or not. And we hope that we develop healthy, positive coping skills. But a lot of times it's almost very, very subconscious. It just kind of comes out almost like in our personality, our demeanor, and it's frustrating. It's sad. Sometimes it comes out if you've ever said something to your kids and you said, oh my God, that sounds just like my mother, or my mother said that to me. A lot of times it's something, minor, or, hey, put that down, or stop running in the house. That's normal, right? But when we then have to try to, discipline our children, or we set boundaries for our kids, then those negative effects kind of come through. And if we were communicated with by our parents or grandparents in a negative way, then we're going to communicate with our children in negative, unhealthy ways. So that generational trauma, and we're not talking about just, well, my parents screamed at me, so I scream at my kids. We're talking about something seriously negative that's happened in these generations, and then it's just sort of passed through. In psychology, we call it intergenerational transmission. That's a lot of theory of family and family systems model as well.
I think this is the simplest way someone has put this for me to understand exactly what it means. Thank you so much.
Of course.
I'm going to follow up that, what you've explained. I'm going to have a follow-up question to you, Dr. Mercy. And Dr. TRAYLOR, please do feel free to add, just in case you want to add more spice to what Dr. Mercy would say. But Dr. Mercy, please tell me some of the patterns or cycles of this trauma that you've observed, be it at work, be it in the community. What are some of the patterns that you've observed?
Dr. TRAYLOR, thank you for putting it, like stepping it down. Generational trauma, like we said, it is known as the ancestral, or like Dr. TRAYLOR said, intergenerational transmission. So it is the transmission of trauma or traumatic experiences and their psychological effects across different generations. Now, it's not that because I experienced trauma, I will pass down trauma to my generation. No, but we have seen that most of it is being passed down, and it can manifest in different ways. In workplaces, we see people already assume that, oh, my mother or my grandmother was depressed. If I'm feeling this way, it means that I will be depressed. The trauma has been passed down. So whatever their mothers or grandparents experienced or went through, what traumatic experience that made them depressed, because they lived in that experiences, they manifested those experiences, their generation, their kids or grandkids see all those and tend to embed them in their own characteristics. And if something is happening, something that they could thrive out of, they tend to just say, oh, My mother was depressed. My father was depressed. That is what I am experiencing to right now. Depression runs in my family. I am going to be depressed no matter what. Meanwhile, it was something that they could just fight through, but they own it. So we are saying, let us stop owning all those traumatic experiences that we did not directly experience. I see it even in drug abuse users. Oh, it runs in my family. There's no way. Oh, my whole family drink alcohol. There's no way I cannot drink alcohol. My whole family do drugs. I have to do it as well. Or I'm doing it because it runs in my family. So we see all these things in at workplaces, even in schools. We are not saying that these are excuses. These are experiences that they have lived with and they are living with because they saw it from one generation. They are linking it to their own generation to the point that even you have the social cultural impact. Oh, this is how my family or my mom always do this. So this is how I should do it without even understanding the dimension or the trigger or what it is manifesting in them. But it just seems like it passed on. Even sometimes not seeking help with mental health issues. Some people really, really need to seek help. But because it was a topic that was never discussed at home, they lived inside, traumatizing themselves because past experiences. My father was an abusive man, was an alcoholic, never sought help. Mental health should not, is a sign of weakness. You live in that traumatic experience to never seeking help. Violence is a big one. War is a big one. Some people still are going through the effects of war that happened 10 years ago in the society. They are still going through that. They did not experience it directly, but the impact of it is still manifesting in their lives. Even just education, for example, you will be surprised that some parts, anywhere in the country where you go, education is not something that people invest in. Because my parents did not do this, I will not do this. So we are saying that while trauma highlights can be transmitted through suffering or it underscores something like resilience, no matter how resilient you can be, or you have adopted the trauma into your own lifestyle, seek help so that you can be helped. People come and say, oh, I've been down. They cannot even tell you the symptoms that they are feeling, but they just understand that because I have seen my mother down for so many days, for so many years, I believe that is what is happening to me without trying to identify their own triggers, without trying to identify that something else may be going on. But oh, my mother used to sleep for 3 days in a row, not even going out to check the mail, not even going out to check what is wrong. When I start feeling low, I should just go ahead and sleep it off for 3 days. Or I should just say, yes, I think I think I'm having bipolar just like my mother does, without thinking that it may be something else, without seeking healing, without being resilient. We just said, okay, it's a transference of trauma, which affects people differently, but we should stop adopting those. We see a lot these days in mental health care. We should not be adopting what we believe that it is cultural, it is spiritual, it is psychological, what the previous generation went through.
Thank you, Dr. Mercy. Now you've got me thinking, and I want to ask this question. It's a follow-up question to what you've said, but I would like Dr. Traylor to tell me, would you say this is a kind of a subconscious um, would you say this is subconsciously done, or do you think, or would you say people will grow up and think, okay, I need to ensure that I behave this way because it is the right way to behave, you know? So I'm just want to find out if behaving the way your parent used to behave, for example, is a subconscious way of doing it.
I
I mean,
kind of
from
like
a psychological perspective.
I like the way Mercy said it in terms of we don't even have to have like purposefulness of it. It just kind of comes out as a reaction. I think I like what she said about education. You know, for some people, it just was never, since it was never valued before, it's not going to be valued for me. I'm not going to value it for my kids. I think that, you know, as human beings, as human animals, our brains like routine. They like pattern. They don't like to change things. They don't like to put a lot of energy into changing, even in a good way. It's hard to, you know, say, okay, like what Mercy was saying. Well, my mom, when she got depressed, she just stayed in bed for 3 days. So it feels okay. If my mom did it, then I'm going to do it. And if you don't see the, wait, that's not healthy. How do I take care of myself better? How do I show my children something better? You know, I know in here, my parents were raised in the Northeast of the United States, and their parents lived through the Depression. And so then my parents said, well, we were raised by children of the Depression. So they adopted some of the, you know, very, very tight with money, very anxious about money, you know, and it was all also about putting on a front that you weren't, you know, that you don't talk about money, you don't talk about being worried about money. And so I think part of that also, I'm probably getting off your question or answer, but really anxiety, I think, plays a great deal. You know, we were talking about depression, but I think anxiety as well, that fearfulness of, can I do something different? I don't know how to do something different. I'm afraid of, what if it's worse? What if I make it worse? What if I fail? What if my children see me fail? You know, so it's easier for our brains. It's easier for patterns in behavior to just do the way it's always been done. But to say, nope, I'm going to stop. I'm not going to be anxious about this. I'm not going to just work real hard and try. I'm going to do something different. I'm going to improve myself. I'm going to talk to my kids about things that my parents never talked about, you know, and bringing things out into the open in healthy ways. And that's where I think also what Mercy said is also spot on about seeking help. You know, the good news that I've seen, it's so interesting, you know, working with geriatrics, because that generation seeking help was not encouraged. Now, you know, I'm 50, so my generation was like seen as a status symbol if you had a therapist or a psychologist. And now we see these other younger adults in their 30s where accessing psychiatric help is a benefit as well. You know, where it's not a stigma to talk to your doctor about depression, about anxiety, about bipolar. I mean, and I think the good thing, the change that is a generational change is like that is seeking help is not stigmatized. I can say here in Texas, here in the US, it's not stigmatized as much as it certainly used to be. And that is definitely progress for sure. So bringing it to light, I always say shine a light in the darkness, you know, and it's hard. It's scary to shine a light, you know, and bring that out.
Thank you so much, Dr. TRAYLOR. That is, you know, I was hoping to hear, but I thank God you didn't say it because this was my next question. But I was hoping to know more about the role that mental health and therapy play in addressing this trauma. So if any of you can just give me, you know, a few thank steps or a few roles that they do play, that will be helpful to our listeners.
Yeah, mental health the first thing we do is try to encourage people and to create that awareness, because sometimes people go through that without knowing that they are going through that. So we raise awareness about generational trauma and its effects. We introduce that to the patients. That's why sometimes it is very important that we do a history of the family. It gives us an insight into what the patient may be going through. We encourage open conversations about topics in families, in communities, and in educational settings. We provide education and information about history and the context of trauma. Then they can start saying, oh yeah, this happened in my family. Oh yeah, my family has gone through this or has experienced this. With therapy and counseling, we encourage individuals, not just individuals, but families, because remember, it's generational. One is being passed down. We encourage them to seek therapy and counseling as families to address the impact of the trauma in her lives or in their lives. Therapists can help individuals understand and cope with trauma and develop healthy mechanisms. Sometimes we are teaching them when you start thinking this way, or when you start feeling this way, or when you start behaving this way, these are some of the tools that you can use. Coping mechanism, healthier coping mechanism, not just sleep and think about it, or not just drink it in alcohol or different routes of unhealthy seeking help behaviors. We help them to heal as a generation or as intergenerational or as ancestral. We help them to come together to heal. We promote healing. We emphasize cultural and community strengths. Sometimes it is something that has been happening in that family. So we want to heal it together as a family. Let them talk it out. We emphasize the fact that engage in activities, engage in physical activities, engage in practices, traditions, ceremonies that support the well-being of not just that one person seeking help, but the whole family as a whole, to break that cycle that their next generation will experience it. We encourage positive parenting and family support. Maybe what I gained from my parents that I'm suffering from now, they are not even suffering from those anymore. So they can even be the one to support me, or what? We just support each other and go through it. And parents, sometimes we have gone through certain things. I see some things that I do now with my kids that my mother used to do with me. So it is for me to say, okay, this is good or this is bad. So I can say, oh, I sound just like my mother. Is it in a good way or is it in a bad way? If it is in a good way, we want to promote that. If it is something, unfortunately, not everybody has it in a good way, then you want to stand back, recognize it for yourself. Then you take a breath, you know how you want to positively influence that to the next generation. We encourage community support as well. The community should meet once in a while, talk about things that are happening. Some homes are broken, and the only people that can support them is the community. So, cope with effects of generational trauma, engage in community driven initiatives that promote healing, empowerment, and positive change. We encourage cultural identity affirmation. Who are you? Promote your cultural identity and take pride to reinforce a sense of belonging and connection to your heritage. That way, you know who you are and you can handle your trauma anywhere you are without feeling lost, without feeling like you're not competent, without feeling like you don't belong anywhere. Include yourself in your institution, in your organization. Find out who you are and how you can positively embed those positive practices. Again, Dr. TRAYLOR said trauma informed care. Seek those trauma informed practices and practice them in your lifestyle so that you can break the cycle one day at a time.
Well, Dr. Mercy, thank you so much. That was so enriching. And the more you talk about these, the more questions I have. And I'm so tempted to go out of the questions that we've set ourselves today. But unfortunately, I'm going to try and stick to it. If I do ask a question that was not pre-planned, please do forgive me. I'm being educated. So I'd like to welcome Kalea ELLIOT. She's joined us. So I'm going to pop her on the stage and I'll let her introduce herself to us. Hello.
Good morning.
Welcome. Thank you for beating that technical issues and thank you for joining us.
Thank
It has
you.
been an interesting conversation and we're already going into the matter of things, but I'll let you introduce yourself to our audience so they know who you are, where you're joining us from, and then we can continue with our conversation.
Okay, thank you so much for the opportunity to join. My name is Kalea ELLIOT. I am the Director of Peer Services with Family Community Case Management. I'm also the co-owner, and I'm also a peer mental health peer specialist and supervisor for our company as well.
Thank you, Kalea. Thank you again for joining us. This is awesome. We have a team of four. Yeah, a team of three because I'm just there to listen and ask all my silly questions. Kalea, let me come to you. Tell me, from your perspective, we've talked all about generational trauma and what it is and how it is, and we've got into the deep of that. The question that I had jumped because I was waiting for you to come and answer this question is more about if you have ever experienced trauma, and if you want to describe it, and if you want to tell us what maybe Dr. Mercy and Dr. Traylor have not. Is trauma something you've experienced in the past?
Of
Of
course,
course,
yes.
yes.
Growing up
Growing up
in
in
a
a
society where
society where
I have,
I have,
like for instance,
like
I'm
for
from
instance,
East
I'm from East
Texas, and so
Texas,
growing
and
up
so growing
in
up in
different
different
demographics
demographics
is
is
um, more of a
more of a
I don't want to say segregated, but it
segregated,
is
but
a
it is a
separation of
separation of
identities
identities
within the
within the
community. It's
community.
not like
It's
it
not
is
like
now.
it is.
There were things that I had to experience myself, whereas um, abuse in the home, drugs, death of very important family members, all of these things bring a certain amount of trauma. For me personally, I experienced those things on a very, very, very deep level, and it caused some um, it caused some issues with myself. It caused issues with my personality, where there was a long time I didn't know who I was or what I wanted for myself. So it made it very hard for me to navigate life earlier on unless I got the professional help, such as group courses, such as talking in safe places, creating those safe places for myself, and establishing my boundaries. And you know, in dealing with that, knowing what I went through as a child made it different to navigate the things that I went through as an adult. Sometimes it set the precedence for that, but also it helped me to change that for my own children. I didn't want my children to walk through the same thing that I did.
So much, Kalaya. I think I can see a connection because you've talked about identity. Dr. Mercy has talked about identity. Dr. Traylor has honed on that as well. So this brings me to understand that the mindset is the starting point. If we understand who we are, then we'll be able to manage what we think. So the mindset is what we think and how we react to the things that we think about. So if we know who we are, we're going to deal with all this differently. Can you tell me a little bit about the pattern, some of the patterns that you've noticed in your community? It is true that Dr. Traylor, Dr. Mercy, they've talked about the pattern, but I just want to find out if you have other pattern that they might not have mentioned and, something different. It's okay if you repeat yourself because the more I hear about it, the more it's okay if you repeat them because the more I hear about it, the more I know. So it's okay.
No,
What are
it's
some of the
not a
patterns?
problem. So in the community, I've noticed that one, the pattern that I see is that our parents didn't know how to navigate emotional issues or trauma that they've experienced, and inadvertently passed it down to our generation, the new adults of the generation. And from that, those who do know and do understand what they are, what they want to do, how they want to heal themselves, they go on to seek that healing. But those of us that didn't have the support, didn't have the knowledge, the know how, or the want to, stay stuck in that pattern of toxicity that their parents stayed in, that their parents' stayed in. And now they're spreading that on to their children, and those children are having to live these lives. And some are teenagers now, some are babies, but they're having to live these lives in high levels of trauma because their parents didn't know how to navigate their own healing, nor did their parents' parents. So there is not a true guide for those people to navigate through issues and not creatively talk, but supportively talk and safely talk through issues. in a healthy manner. They know yelling, they know fussing, they know fighting, they know those things very well in deep anger, but they don't know to set the anger aside for a second and address the true issue that's going on. Because for us, and we all know this, anger is secondary. But if we get a chance to sit with what is making us angry or what's causing that anger, we can actually address it and anger dissipates. We can still be angry, but now we can actually process through that anger and heal. Without that, we can't. That's the pattern that I'm seeing.
Thank you. I think you added quite a lot. Thank you so much from listening to you from a different perspective. I'll come to something that Dr. Mercy mentioned, but I would love Dr. Traylor to hone on it. Dr. Mercy mentioned some of the tools that we can use to solve this or to break the cycle. Dr. Traylor, can you tell us some of the tools that you use, at work to support your client, to support your patient, on healing, through their healing process?
Yeah, Kalea was saying some things. Thank you for sharing your experience, Kalea. I mean, because it's one thing as an outsider looking in, a fascinated observer, an analyst, but to hear from someone that's been through these things, that's very powerful, and I appreciate you sharing that. And as she's talking, I was almost like jumping up, oh, me, because I think the very first thing we can teach ourselves, we can teach our parents, we can teach our children is open, safe communication and talking about feelings. And I think what we have to learn, the very first thing is it's okay to talk about being sad. It's okay to talk about being scared. It's okay to talk about being mad. Those are all okay. You have to respect and trust when you communicate. You have to. And so, and it's interesting because we do have patterns about communicating where if I bring up something to my dad about something he said I didn't like, and then he gets defensive, and then he's like, well, I didn't, and then it's a whole nother off the track. It's not going to be effective. But showing ourselves and the people around us that talking about feelings, about a topic, we call it, in psychology, we call it a process comment. A process comment is making a comment about the process. So like I said, Kalea, thank you for sharing that. It really meant a lot to me. I think this setup is really great, the way we're sharing these things. That's a process comment. And I wish families did that more. It's so funny. I told my daughter, I tell my daughter all the time, I have 2 daughters, and especially my oldest, I tell her all the time how proud I am of her. And not that my parents I knew my parents were proud of me when I was growing up, but they never said, we're so proud of you. And so I told my daughter the other day, I'm like, you must get sick of hearing me say every day, I'm so proud of you, because she's amazing. She's so great. But, so that's just an example of talking about something that someone never talked to you about. And I wish this wisdom, this knowledge, I wish we could tell a 15-year-old, listen, it's okay to talk about something that you're feeling inside that doesn't feel good. And I want you to, even if you don't know how to say it, just start talking, and I'm going to start listening. And it's okay if you just talk till you feel you're talking about what you want to say. And I'm not going to get mad. I'm not going to get scared. I'm not going to turn it back on you. It's not going to be about blame. And that's hard, because that's where you got to break the cycle about talking about things is okay. I may not like what you have to say. I may not agree with it, but I want you to say what your truth is, what your life is, what your experience is, because then that communication is going to be the first step in breaking that cycle that we can talk about and say, look, when this loss happened, I couldn't even get up the next morning. I couldn't even, so it's funny, at 50, I feel like I just say everything. I'm just whatever's out there, whatever I'm feeling. I mean, in a respectful way. I can't talk around things anymore. I don't have enough energy or cognitive mental energy to be real nice about things. I'm just saying, here it is. So I think what we can tell our children and what we instill about parenting is it's okay to talk about difficult things and to sit with difficult feelings. That's okay.
Wow. Thank you, Dr. Trello. Maybe we want to divide this into different boxes, and we want to say, um, from a psychological point of view, we've all established the fact that this is unconscious. I will not get up today saying, oh, when I get to 18, I'm going to start drinking like my parents, because in my home, everybody drinks. I'm going to start drinking. But it is something that the older you get, you start seeing this pattern. And this is only because it has been imprinted, as Dr. Traylor said, it has been imprinted in your brain, in your mind, and you can almost like, I want to do this, So, but we want to break this. We want to break this cycle. It is true that Dr. Traylor mentioned that now she's telling her daughter, I'm proud of you. I just recently started telling my daughter I'm proud of her. Sometimes we saying I am proud of you, or saying something should come from from your heart. This is not something that you just get up and pretend like some people would do. So you see something, it connects with you, and then you want to give a positive feedback about it. So what are some of the ways, I mean, Dr. Mercy, I'll come to you. What are some of the ways, or some of the things we can do to break this? Dr. Trello has mentioned some of the things that she wish, she had a lot of it. She used to have some, but not a lot. From the other side of things, if I flip the coin and come to you, Dr. Mercy, what are some of the ways that we can break this cycle, this trauma, and get everybody in the right mindset?
Kalea, so nice to see you. I know all the details. All had this moment. Oh my God. Thank you. I'm so happy. Dr. Trailer, I know you were busy, had a super meeting morning as well. Both of you have touched what I am about to say in a very simple way: emotional processing. Emotional processing. In psychiatry or psychology, mental health, we provide a structured framework for processing emotions associated with whatever you're going through. Let's say emotions associated with trauma. What do we want to do? We want you to express it, we want to validate it, then we see how we can cope with those difficult feelings. Sometimes some people experience trauma 10 years ago, and just expressing it and validating it brings the trauma again all back like it was just happening. We want you to have some healthy coping skills and navigate through those difficult feelings and essentially heal from them. The coping strategies of symptoms of trauma, like trauma, depression, anxiety, these are critical that we are trying to teach you how to manage those day to day. But first of all, we want to explore the roots of the trauma. Therapy allows individuals to explore the roots of generational trauma. That way, it helps them understand the family history and past experiences. That way, we can shape why we are still struggling currently with something that happened. How did that shape our behavior, and why are we still struggling with that? We want to break those harmful patterns. I'll keep saying it starts from home. It starts with the family. Like we are telling our kids all this, we want our kids to be million times better than what we have been through or than what we are. But sometimes we have shortcomings in doing that because we are focusing on the one or two things that they fall short from without realizing the 100 things that we need to be reminding them that they are good at. So let's break those patterns and start encouraging them, start seeing their positivity and not just their weaknesses, but tell them their strengths. Yes, the weaknesses can be addressed in a positive way. We want to build resilience in them. It starts from the home, it leads out to the community, to the society. And of course, mental health therapists, everybody, counselors, everybody is there. I have seen even school counselors sit with children and talk. And it's funny how children will tell their counselors things that they have not even been able to tell their parents or tell someone from outside or a mental health practitioner. things that their parents are like, what? Huh? He said that? I didn't know they were going through this. So it takes everybody, all hands on deck, to make sure that we are breaking the cycle. Let's build resilience in people who have gone through trauma. We have family and relationship support. Family therapists are there, cultural sensitivity. And we go into these personalized people going through that trauma. What are their interpersonal skills? And how do we prevent this trauma from going to the next generation? We have advocacy programs and resources. Mental health practitioners or therapists or everyone, we have resources that can connect individuals and family with community resources, support groups, advocacy organizations that can further aid in addressing generational traumas. So let us use all this in our advantage. You have trauma focused therapy. We have many experts who are specialized just in handling trauma. Give them a shot. You may be surprised at how your life will change. They say live your new life when you change your mindset. And it is also very important to realize that you're not alone in all of this. You just need to speak it out. Then you'll be like, oh, I went through that too. Oh, my so went through that too. And you're like, oh, really? So I am not this isolated, crazy person in my own bubble. I can get to people who are going through the same thing and heal from there.
Yeah, let me just piggyback something on that Mercy just said about empathy, meaning hearing it from someone that's been through it is so powerful, because then you can see, like Kalea, like she says, I've been through this and here I'm standing, I had to rebuild the tower, but I'm still standing. And to see someone else having gone through because I can't say that. I can't say that I experienced those things. I can say that I'm experienced at helping someone through processing about it, but I can't say. So empathy is a big part. And I love that Mercy twice, I meant to say this, she keeps talking about community, and that part of the healing of that and breaking that pattern has to come through the community, whether it's through the church or the community mental health center or the anything, whatever community base that is. That's such a large part of also breaking that, generational transmission. And honestly, when we talk about therapeutic processing of loss, the number one thing is, I think to say, I want to hear what your experience is. I want to listen, and I want to validate, help me understand, ask questions, say, listen with the intent of wanting to hear, and then reflect back on what your perspective looks like. And that's where we start when we have someone strong like Kalea, and we could start saying, I can't believe what you went through. That's amazing. Thank you for sharing that with me. How do we start making steps toward the healthy, toward and I would imagine, again, I don't know, that trust and being able to trust whoever you need to talk about it with, building that intimacy in the families and when I say intimacy in families, that means that connection, that intimate connection where you can talk about hurt feelings, you can grieve together, you can say, I really want this to not be yelling. I really want this to be not drinking. I really want this to be not scared, and making that intimate connection and trusting someone in your family, and then leveraging that intimate connection to build and feel better. So I didn't mean to jump on in there, but Mercy just said twice about community, and that's really a big part of it.
I agree, and me and my jump-ins. I'm sorry.
Oh, you're not jumping. I really want you to talk about boundaries. I know you do that a lot, Kalea. You have changed not just lives, but you have changed communities. I really want you to jump again on boundaries and all the goodies that you're doing. It's the first time I met you, I'm like, So yes, you are doing so much that you take credit for. You meet people in their own space. You don't even wait for them to come to you. You understand their difficulties. You are mobile. I mean, we speak the same language in different ways, But I really want you to talk about boundaries because you are great in what you do.
Well, boundaries, one, I'm gonna be very honest and specific. I am new in the area of boundaries. And it comes from a lifetime of not having very strong boundaries. But I always have to realize that boundaries are a way that I can show people how to respect me by
Mhm.
how I respect myself. Yeah, and that's when breaking a generational curse, sometimes you have to start with a very firm boundary. One, I'm not going to allow you to talk to me this way. If we're going to continue this, I'm going to cut this conversation. Love you to death, but I'm going to go. When we can talk like we are two people that like each other, then we can conversate. Until then, I'm going to go over here and I'm going to hold my peace. And being okay with that, being okay with setting those boundaries, even with people that we love, because sometimes we have to set them and it's difficult. And also understanding that setting those boundaries make us uncomfortable because we are coming from areas of people pleasing and
Yeah.
wanting to be liked and loved and keeping peace and all of this. But we feel these feelings of anxiety, shame, hurt, neglect, and where we push people away because of how we've been disrespected. But we have to understand we don't deserve to be disrespected. We don't deserve to be mistreated. We deserve to be respected, treated in high regard by our own self. And how can we tell anybody else to do that for us when we don't do it for ourselves? So
And we expect
building,
that we are going to lose them.
hmm and not being afraid, and I hate to say this, but not being afraid to lose a friendship or a family member behind keeping hold of a boundary and holding respect for ourselves. And being and telling ourselves it's okay to do these things. So giving ourselves the permission to set these boundaries and live through the emotions on the other side of it so that we can get to the healing that we need. Other than that, they can either, like I like to say, they can either come to the carpet or they can walk out the door. It's totally up to them. But we set the boundary for us so that we can get the healing that we
Yeah. Yeah. Our moderator is having some network issues. I'll jump into her. And have any of you experienced low self-esteem as a part of generational trauma or as an effect of generational trauma?
need. Yes, most definitely. There was a point of time where, and this was in my first marriage, where my ex-husband dealt with a lot of trauma from his childhood. I dealt with a lot of trauma from mine, and it made me lose exactly who I was in that moment. I didn't know, I didn't think I was a good mother. I didn't think I was a good person on this earth. I dealt with a lot of depression, and I dealt with a lot of, and of course, there was a lot of death around that time as well, and not to mention the death of my marriage. And so I had to walk these dark areas in my life, trying to understand that no, this isn't something I caused. This is some things that are happening to me and that should not define who I am, but it was defining it because I was losing the confidence that I had in myself. Actually, I lost the confidence that I had in myself as a human, as a woman, as a parent. And I didn't know how to find my way back at that point in time. And it took some years in therapy. It took some talking with people, creating those safe spaces for myself for me to come back from that. And here I am at 43, and this is when I was in my 20s trying to figure it out. And life was very new for me. And so encountering loss of self and self confidence and self esteem, that comes with that comes along the journey.
I think it would come from trusting your own judgment, because in when you're a victim of trauma, you've been told, you've been treated in a way that what your decision is can't be right. And so then you have to retrain yourself. Wait a minute, I make good decisions. My gut tells me good things, even though somebody else told me not to, that it wasn't. I can now trust myself. So self-esteem really also comes from trusting your own judgment. And all of a sudden you're like, well, shoot, I can make good decisions. I can make self-care decisions. It's okay for me to say, nope, that's not healthy for me. So I'm not going to do that or say that. And trusting your own judgment is almost like the best form of self-esteem, to say, oh,
Yeah.
I can do that.
Yeah. Yeah, you've even met people whom you're like, oh, you're beautiful, and they feel like you're just trying to please them, when actually they are beautiful, but they have no sense of confidence, like you said. They have no sense of self-worth. They grew up in a space where they were never acknowledged, their voices were never heard, their opinions never mattered, and it's a subconscious behavior that they just grew up that way, feeling like you're not worth anything. You cannot even seek opportunity. Like, who are you? You just need to be that person that they have said you are. Not supported, isolated, unheard. Just stay in your corner and you work. Have you met people that you see them in 5 minutes and you can tell, like, oh, they are lost somewhere, something is lost in them, let me help them find it. And most of the time, like Dr. Traylor said, it's a loss of confidence, not knowing who you are, not acknowledging your potentials. But it also stems from the fact that no one had ever told you you had any, and you've not even been able to see what you have in you. So it's 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 sad. It's sad because this can just lead to more mental health issues down the line. And we are seeing that conflict resolution styles or upbringing is different if we want to also break that pattern of generational trauma. Sometimes we grew up from a household where it was violence, it was either violence or passive aggressiveness or avoidance. Don't talk about it. Then you grow up, you start having that habit of not having a healthy conversation, of not having problem solving, of taking self-care like you're being selfish, of not even caring for your own self without someone accusing you of being selfish or something. You grow up in that pattern and you just pass it from one generation to another. Have you guys seen that repetition going on?
Very much so. Um,
Very much
de-
so.
sorry, definitely in.
Sorry, definitely
So I'm getting a little echo, but definitely in communities that I've been serving, where I get people and I sit in my comfy chair. I have a comfy chair in my office and I love it because it makes people feel they have that impression of safety. And and I get people who were once like me and I self-identify where that confidence is lost and that light is gone. That and I can definitely speak to that. What am I doing about the issue or what am I doing about the problem? Is it for me to fix? Not me personally to fix, it is for me to guide from where I sit as a mental health professional. It is for me to help them guide through what's going on in their own lives so that they can find a resolution, find the confidence, be confident and sure in those decisions that they're making for themselves, and walk with purpose. When we don't do those things in our communities and we were shutting down conversations, even the hard ones, we also shut down the confidence for everybody else to make their own decisions and killing their own self-esteem. This is something that happened to me. I wasn't able to speak on any of the issues that I was going on, and I was made to feel shame when I did. And it wasn't until I owned the courage myself to speak and be sure about what I speak. I'm make good decisions. 43 years on this earth, and I'm still breathing, and so I make good decisions. And if I don't make good decisions, I have to make confident decisions that that was the right decision at that time. And I still have to own and have that self accountability for myself for any decision that I make. In that, I own my own confidence and my own esteem, and I don't give that power away. I hold it. So being able to show the people in the communities that we serve how to do these things, building those coping skills, building self-esteem is like building a coping skill to me because it helps them to make the decisions that they need for their life and not give that power to somebody else who has either a louder voice, a bigger personality, or unfortunately, this has happened in some settings, a bigger degree, and where they've actually given that away. And those are forms of abuse, you know. So we're having having that ability to teach them those things makes it worthwhile for me.
Yeah, absolutely. And the audience is asking, what advice do you have for individuals who are currently struggling with the effects of generational trauma? Dr. Traylor?
So the question was, what's the advice for people dealing with?
Yeah, that some people are watching right now who are going through generational trauma, and some of them do not even they don't see how to break through that. What advice would you give them?
I honestly say that the very first thing we have to do is survive, right? We have to survive. We have to take care of ourselves first. That's why they always tell you on an airplane, if they lose cabin pressure, the oxygen mask drop, you put yours on first before helping someone else, right? You have to take care of yourself. Not that it's selfish. It is what Kalea was talking about, self-care.
Mm-hmm.
We have to take care of ourselves if we want to then be able to take care of our children. And also having that good boundary to say, if there's this unhealthy person, this unhealthy process, I have to excise that out. I have to, in an appropriate way, say, I know my dad always blames me for not being able to retire because he raised kids. That's not healthy. That doesn't help me now for him to try to keep giving me that guilt. So I'm going to excise that. It's not that I don't love my dad. I love my dad. I don't like when he says, well, I can't retire because I had to raise kids. Okay, that's not helpful. I'm still going to love my dad, but I'm not going to keep throwing myself under the bus of him, of saying, oh, you're right, Dad. You're so right. Okay, I'm not going to go do this. I'm going to go come help you every day, every other day, because, you know, and I see that intergenerational transmission of who are we obligated to. Now, of course, we love our family. We're obligated to our family. We are not obligated to destroy ourselves just to stabilize someone else. That's not an obligation. That's not a healthy taking care of anyone, right? It's another analogy I use in treatment is, if you're on the dock and you see a drowning person in the water, if you jump in to save them, they will drown you and then they will drown. Okay. And then all is lost, right? So you stay on the dock and you get them a rope, a life preserver, a something, you know? So it's not being selfish to, I mean, I'm all for, if someone says, hey, that person's drowning, I'm like, I'm on it. Let's go. I'll just jump right in. I'm that kind of impulsive person, but that's not what's going to help them and eventually me, you know, so I need to make sure, okay, what do I have? All right, okay, I've got this life preserver. I'm going to sit here and say, here's a rope, here's a life preserver. So people that are dealing with this intergenerational trauma right now, the first thing is, what is healthy, appropriate self-care? How do we excise something that is unhealthy and not let it change ourselves, and then our ability to take care of who we need to take care of. I have minor children. I have 2 minor children. I have to take care of them. I love them too. And most days I like them. So I have take care of them in a healthy way. If there's something negative that's keeping me from, so it's almost like that triage. And in my busy life, that's what I do. I triage. What am I doing right now? What's my time horizon? But the very first thing, take care of yourself. Triage what is important and what's healthy, and and what is sustainable, right? Because if my dad says, "Come take care of me," even though he's fine, but he wants it 26 hours a day, 8 days a week, I can't. It's not sustainable. So,
Yeah. An observation from the audience is talking or voicing out what you have in mind, or is disturbing you, is very important. So talking about what you have in mind or what is disturbing you. Sometimes my grandmother used to say, a problem shared is already half solved, because right. So talking about it, and sometimes talking to the right people about it, talking about it to the wrong person. Like if you had used the analogy, Dr. TRAYLOR, saying, yeah, somebody is drowning and you want to help. But if you drown, you jump in the water without person when you can't even swim. What is going to happen? Both of you are going to drown. So talking about what is disturbing you to the wrong person, to someone who needs help themselves, will drain you more, or both of you are just going to go through that cycle. So talk about it. Be careful who you're sharing your thoughts and your mind and what you're going through with. Yeah. It may break you further, or it helps you get out of that situation. Or together, both of you can just hold hands and get out of that situation and seek help together. So I see Adeline is back. How do she of my
Finally
how do
back.
she
I
of
just
my
couldn't drown. I just couldn't drown. So happy you girls were able to pull me out of the water. I couldn't speak, but I could hear what you were saying. So much um I think I'm just gonna give up. I think I'm gonna give up. Am I gone or am I here?
You're here. You're here.
Oh, okay. I just thank you girls. I've been listening, and I think fantastic points, fantastic insight, and also solutions. Some of the solutions that even I am going to put into perspective. I'm going to use it in. I'm not sure if if we've already gone round with our advice to our audience. I know we've been taking questions.
Dr. Trailer will have to leave soon. Dr. Trailer, the audience is asking, what last advice do you have for them? What is your last word for them? And
So
what are you
if we
doing?
can conclude, trailer, if you can tell us in
Yeah.
conclusion.
So, and I'm happy to continue this either offline or come back. I think the human animal is very resilient. And if you ever work with kids, I used to you work with family and kids. Children are like unbelievably resilient. So that I feel like is where we need to invest our most time and attention. I mean, I work with geriatrics, and when someone's on their deathbed and they say, "Oh, I'm my daughter, I want to," that's fine, good, that's all good and well. But if we want our best return on investment is to start talking to children at a young age about, life is messy. Sometimes people do things that hurt us. The most important thing is, like we said, find someone we can trust, someone we can talk with, talk to, not just get talked to, right? So we want to encourage children to talk. We want to encourage that we're going to listen. We're not going to freak out when they tell us something that's terrible or something they're feeling, or say, don't feel that, or you shouldn't feel that. So my really biggest point is that if we can invest in that and talking to kids about emotions and experiences and feelings early on, and that finding a safe person. Dr. Mercy, I love your grandma saying, I wrote it down. I'm going to steal that. I'm going to use it in therapy, because it's true. If we align with people
Mm-hmm.
that we feel that you can read them in the moment and say, I'm going to talk with this person. I'm going to listen to this person. I want to help us both do better, feel better together. That's what we need to tell our children. So that's where I would think a biggest return on investment, because then you can try to you can't prevent bad things from happening. You
No.
can prevent them from being mishandled or
Yes.
chronically mishandled, right? Because we're going to have loss and grief. That's life, you know. God made us to attach to others. God made us to be there for each other. That's how I believe that's how God made us, right? That's why he put us on this earth.
Mm-hmm.
And so we can't just hold our breath and cross our fingers and just, I hope nothing bad happens. But what are we going to do if something bad happens, when something bad happens, and not just say, well, just keep your head down. Don't talk about it. Just go. You're fine. You're fine. We're all fine.
Yeah. Thank you so much, Dr. Traylor. I know you have to go. Thank you so much. And like you say, what I got is we cannot prevent bad things from happening. We cannot prevent trauma from happening, but we can prevent it from re-traumatizing that person, and we can prevent it from going to the next generation. So thank you so much for that input. And
My pleasure. I would be happy to come back in the
yes,
future. But thank
yes.
you guys. And Kalea, thank you for sharing your story with us. I appreciate it.
Thank you
Oh,
so
thank
much.
you.
Thank you.
Have a
Bye
great
bye for now. So, Kalea, I'm stuck with you. Adeline is still having a lot of technical issues, and our
Yes.
other speaker, Miss Jae COLLINS, just could not join us. Something. Is it the first?
It's,
Is the moon? Is
it's
the
the
moon?
rain.
What is the rain? Yeah, let's blame it on that. Is the rain? Is it full moon or not? So anyway, we are glad that we are here. Our audience is watching and appreciative. And the community yourself, Kalea, is you may not see it, but you have impacted them a lot. And a lot of them is going through generational trauma without even recognizing it. They just find themselves following their parents' footsteps.
Mm-hmm.
Well, my mom got pregnant at 14. At least I have waited until 15 to get pregnant. Well, my dad is in jail. My dad went to jail when he was 17. Well, if I go to jail now at 20, at least I've tried. So most of them are just following that pattern, and it's one day at a time. But what would you tell those people? How do we raise the awareness not to fall into that, not to be re-traumatized?
Well, that the first thing that I would look at is where I am. Is where I am. Am I happy? Do I like it? Am I bringing joy to my life and to others' lives? That's a question I asked myself
Right.
when I begin to identify my own trauma, and then too, we're just going to be honest and look deep. There are things that are how we're treated, what has been said to us, how we've been portrayed. We honestly do not like these things. And just to be honest and open about how we feel
Yes.
when we can get to those areas of safety, because not all times we can get there.
Mhm.
Just to be honest about that opens up a bigger door for us to realize that we have been through a lot of things that
Mhm.
we had absolutely no control over, and it
Mhm.
has spread over into our adult lives where we have a lot of control over now.
Mhm.
And now we have to grieve it. And then I don't mean grieve like we got to sit and cry about it all the time. What I mean by grief is that process that we have to go through when things get tough and we
Right.
walk through those things.
Mhm.
So we have to acknowledge and discover our feelings and emotions about the situations we've been through. And we have to understand and accept our emotions and where we sit with them. That's part of those big processes. And
Right.
then we find purpose on the other side of that. What do we do with it and where do we want to go?
Right.
And how do we get there? What does it look like? We ask us ourselves these questions. When we're dealing with generational trauma, we also have to accept there was things in our past that we cannot control, and it was at
Yep.
the control of adults that we deemed as safe, and that's what happened to us. And now we have to accept that we were not in control at that moment,
Right.
and we have to move through that with gentleness and give ourselves grace, and still acknowledge our
I like that, with
what we
gentleness.
can do.
Mm-hmm.
Hmm.
With gentleness. And some of the trauma we caused or we contributed to it, it's time we forgive ourselves.
Hmm.
It's time we forgive ourselves and be gentle with ourselves and be like, okay, it happened. Let's move on. Mm-hmm. And
The
graciously move on. Mm-hmm.
analogy I like is giving myself a heart hug. You know, what I when I see trauma for myself, and I deal with traumatic grief. And so when I see trauma for myself, I feel the anxiety, and it's like a M&M candy. On the outside is this very hard shell. It's very hard.
Right.
And but what do? I pull it close and realize that there's something more important and safe and heartfelt. My heart is on the inside of there. And so I pull it close and I melt the outer shell to get to the inside. And I
Mm.
look at it and I embrace it. And I don't shy away from it. I don't push it away. I look at it, I acknowledge it, and I say, I love you, and I
Yeah.
release that love back out into the environment, because one, I don't want to release my hurt back. I want to release something more positive that'll give me purpose. And so I learned to release my love back into the environment. What does that do? That changes my mental chemistry. I'm no longer holding that grief. I've released I've changed it, I morphed it, I've released my love back out, and now I can do more things. And it takes time to get there. We
Yeah.
have to
One day at a
understand and give
time.
ourselves that grace. Uh-huh.
One day at a time. And you hit on it, self actualization, self realization. Who am I? What am I going through? And this will lead me to something that I have realized. We grow up most of the time, or part of the time, people tend to just blame their parents for everything that is happening, all the negative things that is happening to them. They don't thank them for the positive things. They blame, oh, I'm this because my parents did not do this. Oh, I'm, as an adult or as a person at this stage, if you're recognizing that, then it's time to stop putting that blame on people. It's time to stand, self actualize, and say, how do I handle this? How do I, okay, it did not work in the past. What my parents did, let me handle it now. It is my life now. Let me stay in control. How do I move forward without keep holding that rope behind, saying, oh, my parents did not do this. I will not amount to anything, because no, it is your life now. Stand up, move it forward from there. So thank you so much, Ms. Kalea. Thank you so much for your time. This morning has just been something, but we did not sit back and give up. We did everything we could to be here. One speaker couldn't be here at all, still experiencing difficulties, but that's okay. We'll have her in the next one. So, to our audience, please share, let people become aware that generational trauma do exist. And we are already getting a lot of feedbacks and many questions and many suggestions on topics that you guys want us to talk about. We'll do this every month, different speakers, returning speakers. We thank everybody for their time and we appreciate all of this. Have a very blessed day with all mercy. And again, we are so appreciative of everyone who is tuning in and everyone who is joining us in the studio to talk about mental health issues and how all of this change your mind, change your lifestyle. What is health without mental health? So, thank you all for watching and Bye bye for now. Have a great day, Mr. Lee.
Thank you, you too.
Bye bye.